The following portion of Bloom is sponsored by Turning Point of Tampa.
Welcome back to the Bloom Addiction Special. When does substance use become an illness? There are signs that family members should look for, and help is available. And joining us to discuss is Dr. Hardeep Singh, who is a psychiatrist and addiction medicine medical director with Turning Point of Tampa. Welcome to Bloom, Doctor.
Well, thank you, Gail, for having me. My pleasure.
Oh, it's so great to have you here. And I think it's important to point out that substance abuse can be anything: alcohol, prescribed drugs, illegal drugs. I mean, it really runs the gambit.
That's correct. And even nicotine and things that, I mean, we all drink coffee, but caffeine can be addictive for some people, the energy drinks that are out there in the market.
Yeah. And so how does one determine if they have a problem with substances?
So this is a good question, because a lot of us in this field have seen that people suffer and they don't realize they have a problem, or even if they realize they have a problem, they're ashamed to get help. So I think it's really up to someone else who knows them, a friend, a coach, a family member, a physician. But I think it basically, the definition of substance use, it's called substance use disorder because there's a lot of stigma attached to abuse. You know, abuse is not a good word. So substance use, the definition has changed. It's loss of control by the person despite all the negative consequences. They keep using. They know there's a problem, but they cannot control it, and they cannot stop using. And it affects not just that person, but it affects everyone around them, especially family members, friends, co-workers. And I think it's widespread. So what happens is the person thinks that he doesn't have a problem, or he realizes he has a problem, but he doesn't know how to get help, he or she. And then they start thinking differently. It's a brain disease, and it's a disease like disease of the heart, disease of the brain. And fluorescent MRI studies have shown that certain parts of the brain function differently, thinking is different, the way they perceive things is different, their attention changes, the memory changes. And I think the fact is they feel very trapped. They're not enjoying this addiction anymore.
No, That's really interesting. I never thought of that, because, you know, you think of addiction and, like, say if you had cancer, you'd go get help, or if you had a broken bone, you'd go get attention. But people with addiction issues, they often don't seek the help that they need. What are some of the factors that lead to this?
Well, the cause of addiction is multifold. It's really very complex. But I think the biggest factor that stands out is genetics. And, you know, we can't blame our forefathers for everything, but genes has a lot to do with it, genetics. And again, the studies are going on. There are certain genes, especially for alcohol use, that have been found. And that's very inspiring, because they will be able to target some specific treatments down the road. So genetics is a big one. I think family background, how you were raised in the family, and again, not to blame the family, but we're seeing a lot of women in our center who have had abuse as a child, whatever type of abuse, whether it's emotional, physical, or sexual, doesn't matter. The point is that they have a significant, they use substances a lot. And so that's one. Early onset, start using in childhood, it's hard because it progresses. Experimental, peer pressure, a lot of peer pressure to fit in, with social media especially. People feel like they have to fit in, they have to do, they have to conform, and it's very innocent how they start.
Well, we have just a few seconds left, but I wanted to say help has come a long way, and you are able to provide so many different ways to help people get to where they need to be.
Yeah, I think the help is there. I think people need to realize that this is not something that we'll put them down, or it's very, we want to build up their confidence, we want to help them understand, we want them to come out of the shell, lead a normal life, meet other people who are in recovery. And there are different ways of treating it, and we can't go into all that today.
Yeah.
But there is hope.
That's good to hear. Doctor, thank you so much. It's great to know professionals like yourself are out there to help people in need right now. And first and foremost, call your doctor, and you can visit the Substance Abuse and Mental Health Services website at samhsa.gov. And for more information about Turning Point of Tampa, including AA and NA meetings and therapists who specialize in treatment, call 813-882-3003 or visit their website, tpoftampa.com. And we will be back with more Bloom Addiction Special right after this.
The preceding portion of Bloom was sponsored by Turning Point of Tampa.